Okay. Hi, my name is Sara Ebberts. I am a licensed massage therapist and a physical therapist assistant. I have been doing massage for over 17 years, so about 20 years now. Working as a physical therapist assistant with brain injury patients for about 3 years now. I continue to incorporate massage into my physical therapy treatments because I have seen the benefits of manual touch, not only for the physical body and getting muscles to relax and postures to realign, but when somebody has physical trauma, medical trauma, mental trauma, the ability to be touched in a compassionate, respectful, therapeutic manner greatly impacts their ability to recover from that trauma, to progress in their therapy goals, and to come back into their bodies and be able to have more agency in how they process the sensory input that they're receiving from the world on a daily basis. It progresses the physical therapy goals by allowing that person to deal with the emotional side of their physical trauma in a healthy and more balanced way. You're working with somebody in a physical therapy session and you don't have a massage table with a sheet for draping and massage oil or lotion. You're working in a scenario that is maybe not quite ideal. It's impromptu and you're working through clothing. You're going to work more with pressure and kneading. So I'm doing more kneading with my heel of my hand and with my thumbs, gripping and squeezing and kneading. But I'm always going in the direction that the tissue is telling me to go. And once again, you learn this by feel. Sometimes when you find a tight spot, you might think I'm going to go in this direction, but that knot, for whatever reason, isn't going to respond to that. So be flexible and be willing to just go with the flow and kind of go with your instincts. There is technique, but there's also the need for going by feel and following your instincts with massage. It's kind of a fine balance between doing the cookie cutter routine and being able to stray away from that. So I'm going to come back again and do a little bit more stretching and reorient myself and my client to a new direction of what we're doing. So I'm going to reorient myself and my client to my touch as I change what I'm doing. I'm changing my direction and I'm changing the area on their body that I'm touching. I'm also being very cognizant of how I'm holding my body. So I'm always trying to balance making myself as comfortable as possible without hurting myself and making my client feel very secure and comfortable as well. So when I come down and I work the low back, I'm going to work in smaller circles. I'm going to start up higher. I'm going to find an area of tightness and maybe do some trigger point therapy on that, where I'm just, okay. So with the low back, we have muscles that attach at the low back here along the iliac spine, but then we also have the glute muscles that attach here, and those two muscles can affect one another. So if I need to go in and work the glute, I'm going to tell them, I'm going to work the attachment sites here and explain to them just what I said. Muscle attaches here and there and they affect each other, so I'm going to come in here and work these areas because I find areas of tightness. And that can go for any area that any client might feel It's just generally sensitive on all people. Do any specific acupuncture or acupressure. I just do kind of a general stimulation of these points to get blood and lymph flowing as they should. Okay. So when I provide traction from the occipital ridge, this is what it looks like, anterior, posterior. The chin is lifted. Allow the head and neck, you just got to find that spot. It's a little bit different on each person, but then you find the spot where the head relaxes into your fingers and you get the natural curve of the neck back in alignment. And then you're just going to sit and hold it. Sometimes it only takes a few seconds, sometimes it takes several minutes for things to just settle and relax. My fingers are right under where the skull turns into the neck, but in a side view. So I've got my fingers in the origination site of the muscles, the cervical muscles as they originate from the skull, and I'm just allowing the weight of the head to fall into my hands and create light traction on the neck. If you feel the need, you can take your hands like this, come into the same spot, placing my thumbs underneath the mandible here. Not pulling with my thumbs, but pulling with my fingers and just providing slightly more traction to the cervical vertebra. And then finishing up on the scalp. As I'm working on the head and neck, I am making sure that I always have some pliability in the neck joint. I don't want to force anything with the neck, but I do want to be able to get in to the tissue and allow for some deeper work without having my client feel like they need to resist because of either emotional trauma or because of the physical discomfort of it. I'm always paying attention to facial expressions and body language, any sort of feedback I'm getting from whether or not they're holding or whether they're relaxed. Thank you for sharing your time with me. I appreciate your patience and your attention to something that I feel very passionately about. And I hope that you are able to take what we discussed here today and incorporate it into your own therapy routines. I think you'll be really pleased with the results that you get. Thank you.